For this week's discussion, I am going to be talking about my chosen topic of healthcare disparities I found provided from the link of the Kaiser Family Foundation. The topic I chose was adolescent mental health, which contributes to the entirety of my capstone project and what I'm circling it around. Many adolescents in the United States experience anxiety, depression, and substance abuse disorders, yet many do not receive any treatment. One of the large disparities that stood out to me is the limited access to mental health services for adolescents specifically. We have a lot of resources and inpatient facilities for adults, but it's harder to find placement for kids. It's especially difficult when we run across children from a low-income family, rural communities, minority populations, or underserved areas, which unfortunately there's a lot of that around Parkersburg and surrounding areas. According to Patchell in 2026, these barriers contribute to disparities across the United States for mental health services for adolescents. Most barriers include provider shortages, transportation issues, insurance limitations, cost of care, and the overall stigma around getting help for mental health. The impact that this has on healthcare is that mental illnesses are untreated in childhood and then they go untreated adults, and the trend isn't broken. It's going to affect their emotional development, relationships, and overall quality of life. The statistics that are reported in the Kaiser Family Foundation are delayed treatment can lead to worsening symptoms and increased in mental health statistics of crises. From my personal perspective as an ER nurse, I frequently deal with pediatric behavioral health patients, especially during crisis, because the ER is the first place you go. It's kind of the common joke, it becomes an ER problem. But many families report difficulty finding outpatient resources in a timely manner. A lot of times they're seen and then they don't want to follow up for a month, or there's not a psych doc that can see them within 48 hours to 72 hours following a crisis. They have difficulty finding inpatient treatment facilities, especially if the child is on the spectrum or has any type of history of aggressive behavior at all. The facilities don't accept them. There's also minimal resources. There's not a lot of inpatient psych facilities for children. ERs often become kind of that safety net because, again, the common joke, just send them to the ER. But what most people don't realize is that the ER doesn't always have the resources either or the perfect fix for the issue. The disparity can be improved by increasing pediatric providers, which I wish we had a magic potion for that, expanding school-based mental health support, promoting routine mental health screenings, improving collaboration between parents, providers, schools, and outpatient agencies. The main role of the nurse or a community health nurse in this type of position would be ultimately health promotion of mental health and healthy resources, including like crisis prevention, supporting more of the vulnerable populations that don't have the education of what they need. And according to Nyes and McEwen, the community health nurse plays an important role in promoting health equality and improving population health for the United States.